Thank you very much, Volker, for the introduction. Can I first of all check that you can hear me and you can see my slides? Good.
Yes.
So thank you very much for inviting me to talk today. It's been a great pleasure to work with Volker, Robin and other colleagues at EASAC and IAP. And I think the global report that will be produced will be, I think, very illuminating. What I want to do today really is to summarize for you some of the emerging literature around climate change and health, with a particular focus, of course, on the region of interest today. What I'm going to do is briefly summarize some of the impacts of climate change and the projected impacts of climate change, and then say something about what we can do, both to adapt to climate change, the climate change that we can't prevent, but also to use the health argument to motivate more rapid reductions in greenhouse gas emissions. So my first slide really is courtesy of Jos Lelyveld and his colleague George Zittis, and a paper that they're writing at the moment. This analysis has come from that. And I think what it shows very graphically really is the fact that the temperature of the planet, of course, is heating up. The global average temperature has gone up just over 1.1 degrees since pre-industrial times. That's not, of course, uniform. The land is heating up faster than the oceans, and some parts of the planet are heating up faster than others. And you can see the Eastern Mediterranean and Middle East is showing evidence that the temperatures here are escalating faster than many other parts of the world. So climate change is posing and will pose increasing threats to health, well-being, and to the integrity of our societies. And unfortunately, Eastern Mediterranean and Middle East will be very much at the forefront of many of those impacts. So what are the increasing risks that occur as the planet heats up? Well, this slide is taken from the IPCC special report, a 1.5 degree report, quite a famous report. And it shows you in a very simple way how, as temperatures increase, risks also increase. You can see that, for example, ecosystems are threatened. It's very difficult for ecosystems to keep up, to maintain their integrity in the face of rapid climate change, which of course far exceeds the speed of any natural fluctuations in climate. And the rate of warming is probably more than 10 times greater than that as the world emerged from the previous ice age, for example. So these are unprecedented rates of warming. Extreme weather events, of course, will increase. Floods, droughts, extreme storms, and wildfires, of course. These all have implications for human health. There'll be large-scale singular events such as collapse of ice sheets. Coral reefs, of course, are already dying off. The Arctic region is showing, another region of the world which is showing very rapid change indeed, and that will have implications, of course, for regional and global climates. We're seeing increasing flooding in coastal regions and also river flooding as well. And of course, this has implications, all of these effects have implications for human health through direct mechanisms like heat-related morbidity and mortality, and also indirect mechanisms like the effects on crop yields, for example. Now, these relationships are not necessarily linear. There may be sudden tipping points when we get non-linear change. For example, as methane is released from the tundra, that can accelerate heating. And as we know, if ice sheets collapse, of course, that will greatly amplify sea level rise, threatening the integrity of many coastal societies. So the risks are very, very high indeed. They're still imperfectly understood. And as I'll describe to you in a minute, there are still gaps in the evidence, but we know enough to know that we should be very, very concerned. And we need to put in place policies to rapidly decarbonize the economy in order to minimize these risks to health. Well, where are we at the moment? Current policies projected to take us around 3 degrees, something of that order. Of course, it could be higher if policies are not implemented. And some of the more high-end scenarios have suggested 4 degrees average by the end of the century, obviously not uniformly distributed. The most recent projections that have come just in the last few days, I haven't had time to put them on this graph, suggest that if the pledges that were made recently by different governments were all enacted, we could be about 2.4 degrees. And if we're very optimistic, then maybe just over 2.1 degrees, something like that. But we're far away, of course, from the cuts required to keep heating below 1.5 degrees. So we're far off from that target. In order to achieve that, we would need more than 7% reductions per annum sequentially. And as we know, with COVID, we did get about 7% reduction, but of course that was a disastrous way to decarbonize the economy, and it's caused a great deal of it's been accompanied by a great deal of economic hardship and so on, and certainly shows us that if we're to decarbonize the economy safely, without causing economic disruption, then that needs to be planned and implemented in a very careful and considered way. So unfortunately, we're far away from where we want to be in terms of reducing the risks of dangerous climate change. So what are the implications for human health? Well, as we've already heard, they're quite complex and imperfectly understood. There are a range of mechanisms. I've mentioned the direct mechanisms of extreme heat and other extreme events, but there are also mechanisms through natural systems, changes in natural systems. For example, changes in vectors, the distribution of disease vectors like mosquitoes and ticks and so on. There's also the impacts of climate change on crops, on staple crops, on other crops that are important for human nutrition like fruit, vegetables, nuts and seeds, for example. And finally, there are those effects that are mediated through socioeconomic systems. So, for example, increasing poverty. The World Bank has suggested that in the absence of effective action, over 100 million people could be pushed back into poverty by 2030 as a result of climate change. Of course, conflict may increase the risk of conflict, and population displacement, migration, caused by a range of different mechanisms as a result of climate change. So all these effects are mediated through a range of other factors. And of course, climate change is not occurring in isolation. It's occurring against the background of multiple other environmental changes, like the depletion of fresh water supplies. Many parts of the world, including the East Mediterranean and Middle East, are depleting their fresh water, their aquifers, at an unprecedented rate. And these aquifers cannot be replenished in human over credible lifespans of humans. So there's a potential to magnify the impacts because of the interaction of multiple environmental changes. And very little research has gone on to understand the interactions between different environmental changes, biodiversity loss, land use change, freshwater depletion, and so on. So we've also heard that the evidence for the areas is limited, and I would agree with that. This is a systematic review or a scoping review that we've done recently, led by colleagues Lee Barang-Ford in Leeds, colleagues in Berlin and elsewhere. And this uses machine learning as well as hand searching to identify the health and climate literature. Since the last IPCC report of the last 7 years or so, there has been an increase in the literature over recent years, but it is still quite patchy. There are still major gaps. A lot of it, unfortunately, is of quite poor quality. And you can see that there's also big geographic gaps as well, including in the region of interest today. So you can see that there's really a paucity of research over Africa, of the Eastern Mediterranean, of the Middle East, and even in areas where we do have quite a lot of research in North America and Europe and in China. Much of that research is of very variable quality, as I've mentioned. A lot of it is short-term observational studies about single events and so on, which don't tell us very much about the trends in climate or the impacts of trends in climate, nor do they tell us how to effectively adapt to climate change. Most of the studies have been observational. Rather few of them have evaluated the impacts of actions to address climate change. So very briefly then, the impacts of climate change on health exemplified by this very famous, notorious heat wave, prolonged heat wave in August 2003. Probably about 70,000 excess deaths overall in Europe as a result of that extensive and prolonged heat wave. A number of books were written about it, including this book, Fatal Isolation, that was the title refers to the fact that many of the people who died were isolated, elderly or disadvantaged people who didn't have access to air conditioning. Many people died in residential homes and so on. And we now know that because thanks to advances in methodology around detection and attribution of climate change events to the adding of greenhouse gases into the atmosphere, we can now speak with more confidence attributing particular events and by implication the health effects of those events to climate change. So for example, Dan Mitchell a few years ago wrote a paper suggesting that human-induced climate change was responsible for about 70% of the heat-related deaths that occurred in central Paris during that event. In other words, those deaths were very unlikely to have occurred in the absence of human-caused climate change, because this was such an extraordinary and extreme event. But such events, sadly, will become commonplace towards the middle of the century and later century because of continuing climate change. So this is a real wake-up call, a real lesson for the future. And these are the kind of events that we will have to adapt to. But it's not just, of course, affecting the elderly and the vulnerable due to pre-existing disease. Heat has a range of other effects as well. This is the recent systematic review and meta-analysis showing how excessive heat exposure increases the odds of preterm birth. And you can see that there's overall an increase of about 5% or so in the odds of preterm birth per degree increase in temperature. Now, these studies have been done mainly in relatively temperate climates, and we don't know the impacts in more tropical and subtropical regions, but one would imagine that they would be equal, perhaps more than in these studies. So this has wide-ranging implications for human health, and as we know, preterm birth, changes in birth weight, reduction in birth weight, for example, also have implications probably for life course experience of health. They affect health throughout the life course. So as we look forward to what might happen in coming decades, this is again a recent paper led by George Zittis and Jos Lelyveld and others, looking at projections forward at the likely impact of climate change on extreme heat exposure in this region. And what you can see very worryingly really is how this takes off from mid-century onwards, how you see the heat wave magnitude index accelerating. You get heat events which are unprecedented today, really, what they call ultra extreme events, which have not been experienced up to now. And so these will really provide really challenges, I think, to human societies to maintain their integrity in the face of this intense heat. And the bottom part of the slide shows you the percentage of the land area exposed to these extraordinary levels of heat in the latter part of the century. And these could involve temperatures up to 56 degrees centigrade or higher, and they will be of extended duration. This is particularly lethal because if you can't cool down overnight, then the risks of death accelerate. And this undoubtedly will cause major impacts on human health and threatens, I think, to cause widespread increases in deaths. So by the end of the century, perhaps half of the population in the region could be exposed to these events annually. And even if these business as usual scenarios don't occur, we can't be complacent, because even lesser degrees of heating will produce very severe impacts. It's important to recognise too that many deaths occur outside formal heat waves. Heat waves are by definition the most extreme end of the spectrum. But as you alter the distribution of temperature, you actually increase the exposure to heat, even at levels below those classified as heat waves, also increase mortality death rates. And of course, it's not uniformly distributed. Cities have much higher heat exposures than those in the surrounding countryside, partly, of course, because of the absorption of radiation and then the reflection and the radiation emitted from surfaces, from road surfaces, from buildings and so on. And we know that these urban heat island effect can be quite profound. It can result in 5, 10, even more degrees centigrade differences between the city and the surrounding countryside, and also big variations within the city. and that can be modified to some extent by green space that can provide cooling, and also seems to reduce the risks of heat-related death as well, and possibly water-related lakes and ponds and so on as well. Can also provide some cooling during the day, although they do radiate heat at night. So cities will amplify, of course, the heat signal of climate change. Another effect that have profound implications for human health is wildfires. And a big review recently has shown that wildfire risks are increasing as a result of climate change. The map shows you where that's happening. We've seen these wildfires in California and Australia, but also less well documented, but also important in sub-Saharan Africa, Asia, and of course in Latin America as well. Some of these fires are started, of course, by human activities, but then they spread and they're propagated because of the extreme drying and extreme heat caused by climate change. There are a whole range of health effects of wildfires, including physical and mental health. But one notable fact is that wildfire particles are smaller than those from the fine particles from urban sources. They have a higher proportion of PM 2.5, these very tiny particles which get deep into the lungs, and even smaller ones. And they seem to contain more oxidative components, so they're probably more damaging to health, more pro-inflammatory than the kind of particles, the standard particles you get in urban centres. So they do have major implications for human health in terms of respiratory conditions, asthma, and probably increases in heart disease as well. But then there's the implications of climate change on crops. The map just shows you in very simple terms the likely impact on the productivity of food crops by mid-century. You can see for much of the world those are declines in crop yields. In temperate regions there may be an increase, but we don't know how long that will go on, nor whether people living in other parts of the world will be able to afford to buy food in what's likely to be an increasingly expensive and competitive food market. And on the left side you see a summary of some work by the CGIAR, which summarises some of the modelling studies that show, and they agree, that climate change impacts on crop yields will be negative, certainly from the 2030s onwards. There's already some negative effects in some parts of the world. And unfortunately, nearly half of the projections beyond 2050 indicate decreases greater than 10%. So that's a real worry when we think about future food security and future food prices. But it's not just the quantity of crops, of course, it's also nutrient quality. So as you put more CO2 into the atmosphere, you do stimulate the growth of some types of crops, the so-called C3 crops. Some of those are food crops. But unfortunately, that's also accompanied by a diminution in the nutrient quality. So you get less zinc, less iron in these crops. And we know that already about 2 billion people around the world suffer from micronutrient deficiencies. So climate change could also accelerate and increase the risk of these micronutrient deficiencies. And this stimulation of growth, of course, will not counteract the reduction in crop yield from climate change itself, but will serve to diminish the nutritional quality of crops, unfortunately. And the map shows you where those populations are likely to be particularly. And you can see that the Middle East and the Eastern Mediterranean is one of those affected regions. Infectious diseases, of course, I don't have time to go into much detail, but just very, very briefly around infectious diseases. A whole range of infectious diseases like to be affected by climate change. Obviously water-related, waterborne diseases, foodborne diseases, and of course vector-borne diseases illustrated in this slide. This is taken from some work by Jan Semenza and the European Centre for Disease Control some years ago, where they looked at the environmental drivers of infectious disease threat events in Europe. This slide shows you the vector-borne diseases, and you can see that this is their attribution of the causes of these disease threats. You can see that climate, the third one along from the top, is likely to be responsible for quite a few of these disease threats, and often works in concert with other natural environmental changes like land use change, for example. And of course, these factors can also be amplified by global trade. There's the famous example of the tires imported into Italy that had the larvae of Aedes albopictus, which is a vector of the dengue virus. And that vector has been spreading in Europe, and I think Robin's going to mention that in his presentation in a moment. We know that future climate change is likely to impact on dengue spread. The slide just shows you how dengue could spread late century, the bottom part of the slide. You can see it could spread to 50 to 60% of the world's population as climate change increases over the coming decades. So dengue is, as you know, a very, very common vector-borne disease, which can on occasions be very serious and even fatal. But there are many other vector-borne diseases that are climate sensitive. But of course, it's not just physical health, it's also mental health. And we're beginning to understand now the very pervasive effects of climate change on mental health. There's this term called solastalgia, coined by a psychiatrist called Glenn Albrecht in 2007, the distress caused by environmental change. And this is caused by the fact that the environment is perceived and is in fact changing in front of people's eyes. So it's been documented in Arctic, people living in Arctic communities that had to move their villages because of melting ice, or Australian farmers that lost their livelihoods as a result of drought and so on. Many studies have shown an increase in common mental disorders after floods, wildfires and droughts and so on, because of loss of possessions, increasing poverty, sometimes displacement. And it's also possible that heat itself may be associated with increasing suicide rates. That could be related to changes in crop yield. There is some evidence of farmer suicides increasing, for example, but there may be other more direct mechanisms as well. Drought, of course, has many, many direct and indirect health effects summarized on this slide, and I won't read them all out, but they range from nutrition, mental health, air pollution, vector-borne diseases, and so on. So drought can have long-lasting effects on mental health and make it very difficult to recover from prolonged droughts. And of course, this may result in population movements. This study some years ago published in Science, where the two researchers there looked at the relationship between the temperatures in the growing season of those countries which receive asylum applications, the EU receives asylum applications from. And they correlated the numbers of asylum applications with the temperatures in the growing season, and suggested that as temperatures increased above a certain threshold, I think it was around 20 degrees centigrade, something of that order, then the number of asylum applications is likely to increase, although of course very, very large uncertainties. But at least there is this theoretical possibility that asylum applications could increase. And there are very plausible reasons to think that migration, both internal and international migration, will increase. So in the concluding part of my talk, let me just say a few words about what we could do to act to try to reduce the effects of climate change on human health. And there are two broad strategies that we can take. One, of course, is mitigation. And in climate change terms, when we talk about mitigation, we mean action to reduce emissions that cause climate change. And when we're talking about actions to manage the risks of climate change impacts, this is usually called adaptation. And the concept of resilience is a kind of broader overarching concept, which really describes the capacity of societies to respond to withstand shocks and to build back better. And increasingly, I think we need to integrate adaptation and mitigation. So we shouldn't think of them as two completely separate activities, but the need to develop strategies, interventions, technologies, actions that will take us towards what we might call net zero resilience. In other words, more resilient societies, but much lower environmental footprint. And the slide shows you a few of the things that we could be doing. So adapting to climate change is could give a few lectures on adaptation alone, but let me just give one example, which is the example of early warning systems, which has been used obviously for disasters. I mean, Bangladesh has had a remarkable track record, 300,000 deaths several decades ago, with more recent storms resulting in many, many fewer deaths. So even in a low-income country with early warning systems and storm shelters and community mobilization, you can reduce the impacts of these extreme events. And there's a whole range of research going on at the moment on heat wave early warning systems, dengue and other disease early warning systems, and so on. And they do show considerable promise. I think they could have beneficial impacts, but of course they won't be able to prevent all the effects of climate change. There will be limits, there are limits to adaptation, and these are related to geographical factors, population and demographic factors, and socioeconomic factors. And this will mean that we will not be able, of course, to adapt to all the impacts of climate change. And so we need to move rapidly to try to get back on track for a 1.5 degrees. I mean, we can debate whether that's actually feasible. We've probably lost the opportunity to reach 1.5 degrees, I think, but hopefully we could still keep below 2 degrees, which is the Paris Agreement, well below 2 degrees. And so this just summarizes what we need to do to get back on track. Very ambitious, as you can see. I'm afraid we're not there yet. We're some way away from this. We know that coal power plants are still being planned and opened, unfortunately. It remains to be seen what happens with aviation and shipping, but I suspect aviation will bounce back relatively quickly. It's going to be difficult to phase out fossil fuel cars by mid-2030s all around the world. And in many countries, of course, buildings are hopelessly inefficient and are not being retrofitted at the requisite speed. And deforestation, of course, is happening in many parts of the world. So this is just an example of some of the health co-benefits that could result from rapid decarbonisation of the economy. This is work we did with Jos again. It's been a great collaboration working with Jos and his colleagues over the last few years. And this study really just illustrates, it's kind of a thought experiment, if you like, illustrating what would happen if we could phase out fossil fuel burning to prevent dangerous climate change. And this, in doing so, we also, of course, reduce fine particulate air pollution and to some extent tropospheric ozone as well, which arises from fossil fuels. And this would prevent about 3.6 million deaths annually, premature deaths annually, from ambient air pollution, which, as we know, is a major killer, is responsible for heart attacks, strokes, chronic obstructive pulmonary disease, some of that. This slide, which is about the benefits of decarbonisation, I was also going to mention the benefits of reducing other pollutants. This is some work that it's been led by Jos's colleague Surangsu Chowdhury, where it's looked at the health benefits or the potential health benefits from reducing NO2 air pollution. You know that NO2, of course, is produced by traffic and other sources as well. And it shows you on the left the satellite observed tropospheric NO2 in the Eastern Mediterranean and the Middle East. You can see that there are some quite substantial areas of quite high pollution. And the study used meta-analysis of previous work to estimate the incident cases of asthma amongst children and adolescents attributed to the exposure to ambient NO2. So by implication, these could be reduced if we were able to cut out some of these sources of nitrogen dioxide, which would, of course, occur if we decarbonize the economy. And you can see that there would be substantial reductions in asthma amongst children in a number of countries, as shown on the right side of the image on this slide. So a number of potential health benefits from decarbonising the economy, and these are over and above the benefits of reducing the risks of dangerous climate change. The other point to make is that they are near term. So whilst the benefits of reducing climate change occur over coming decades, the benefits of reducing air pollution occur in the very near future. They occur within months, years of decarbonising the economy. And we also know that other sectors which contribute largely to greenhouse gas emissions, that there are also policies, win-win policies, that can reduce greenhouse gas emissions and improve health. There's a lot of work now on sustainable food systems. I don't have time to go into detail, but we do know that reducing food waste, promoting healthy, sustainable diets can help to reduce greenhouse gas emissions. About a third of greenhouse gas emissions seem to be coming from food systems and land use change, for example. And we know that a lot of that is driven by the consumption of ruminant meat, red meat, and dairy to some extent in high consuming countries. We know that following healthy dietary guidelines, eating somewhat less meat but more fruit and vegetables can reduce greenhouse gas emissions. Vegetarian diets even more, although of course they may not be culturally acceptable in all societies. But nevertheless, we know there's a lot that can be done in food systems to reduce their environmental impact and to improve health. Likewise in transport systems as well, not just reduced air pollution such as NO2 and fine particles, but also increased physical activity. because we know about 5 million people a year die prematurely from sedentary lifestyles, from inadequate levels of physical activity. It's a risk factor for many diseases like diabetes and heart disease. And the best way to get people walking is not to go to the gym. It's, of course, to walk in your daily life when you're going to school or to work or wherever, commuting. So this is a study we did some years ago looking at the potential benefits to the National Health Service if we could get the urban population of England and Wales walking and cycling like the population of Copenhagen. So the graph shows you the benefits in terms of pounds, costs averted to the health system. And you can see that after a couple of years, you get potential benefits, reduced diabetes, heart disease, stroke, and a range of other conditions as well, if it were possible to promote these wide population level changes in physical activity. And we can debate just how practical that would be, but it's again, a thought experiment. We also know that other aspects of redesigning cities can improve health, increase resilience to climate change, and reduce greenhouse gas emissions. I mentioned the importance of green space. It can help to reduce the urban heat island. It can reduce air conditioning requirements, of course, less energy requirements for air conditioning. And we believe it can also reduce heat-related deaths. And this is an example of Barcelona, where they've got this concept of super blocks, where they amalgamate city blocks. So they amalgamate, in this case, 9 city blocks into one big block, which they call a super block. And that they prevent traffic going through it. So you're only allowed to drive your car in to get to your apartment, your house. You can't drive through it. And they open the space for walking and cycling. They plant more trees. And they've estimated that if they could expand this to the whole of the city of Barcelona, they could prevent quite a few hundred deaths a year from air pollution, and also improve health through increased physical activity and increased green space exposure, which seems to benefit not just physical but mental health as well. And then finally, the healthcare system. The healthcare system, if it was a country, it would be about the 5th largest emitter on the planet. So we have a paradox here. On the one hand, healthcare systems are meant to improve health, but on the other hand, they're emitting large amounts of greenhouse gases and air pollutants as well, as by virtue of their activities, so the energy that they consume. And NHS England, National Health Service England, has recently committed to net zero emissions for 2040 for its direct emissions, the emissions from burning fossil fuels and on site, and for 2045 for their indirect emissions, including all their consumption emissions. And they're working with supply chains to help them, to incentivize them to decarbonize their own supply chains. So pharmaceutical manufacturers, medical equipment manufacturers will all have to decarbonize their own supply chains if they want to supply products to the National Health Service. So in conclusion, climate change poses very profound effects and threats to human health, but there is much that we can do to reduce the risks to health, both to adapt to climate change, but there will be limits to adaptation, but also to mitigate climate change. And in mitigating climate change, we can achieve these co-benefits for health in the near term, as well as preventing the risk or reducing the risk of dangerous climate change in the long term. So I'll stop there, but just to emphasize that with COP26 coming up, health will play an increasingly important part in the climate change agenda. There is increasing recognition of the importance of framing climate change in health terms as a way of increasing the motivation for rapid climate action. So I think I'll stop there. This is just a slide on the Race to Zero, which is an alliance of 120 countries and other players to incentivize movement towards Race to Zero. And we believe that the health arguments can help to accelerate this level of ambition. I will stop there. I know we may have run out of time a bit, but happy to answer any questions or to pass over to Robin, whichever's best.
Thank you very much, Andy, for this wonderful overview. And I'm always impressed that each time you come up with new data, which you have not presented, a couple of weeks ago when we were listening to you. It's amazing. George, I have a question concerning Andy. Andy has told us that he has to run off to another meeting. And I wonder whether we, give him a few minutes for discussion so that if there are burning questions, we should be forwarded now. Is this okay with you, George?
Yeah, I think that would be appropriate, Volker. We can adjust the program later.
Yeah. So are there any questions to Andy Haines from the participants? How does it work, George? I mean, are these questions?
I think that people should unmute. I mean, we are not so many, so they could unmute and ask the question directly. Right. So I have a question, Andy. I mean, clearly, the 1.5 degree scenario is, it seems to be unachievable, really. So we need to. I'm always puzzled that possibly we need to go beyond that. So, of course, we should chase that, but we need to kind of try mitigation and adaptation strategies beyond this 1.5 degree scenario. And I wanted to hear your views about that.
Yeah, one of the reasons we think that 1.5 is not really achievable is because we're already at 1.1, maybe 1.18. As Jos has shown in a recent paper, that when you take out fossil fuels, you also take out some of the cooling aerosols. So, of course, mostly fossil fuels are heating the atmosphere, but they also produce sulfates, which are cooling. So when you remove those sulfate aerosols, that also contributes to warming, which is why tailpipe solutions for pollution are also quite dangerous in a way, because if you just cut down the pollution and you don't cut down the greenhouse gas emissions, then you could actually accelerate climate change. So the important message is pollution, we have to tackle pollution, but we have to do so through decarbonisation, not just through kind of tailpipe solutions as has been advocated by some policymakers. So yeah, you're right. We need to really plan for, unfortunately we've got to put everything really behind keeping below 2 degrees, I think. And although in a sense it's a bit of an arbitrary threshold, we don't know whether it's 1.9 or 2.1 or whatever, but the lower we can keep, the less the risk will be, particularly when we come to these non-linear changes that may occur in the Earth systems, that may throw us into an even more dangerous future. So yeah, we have to do everything we can to reduce the probability of reaching that 2 degrees and reducing the risks of getting to these tipping points. That we still don't know exactly where they are in the Earth system, but we shouldn't be taking risks with the whole future of our planet and population.
Yeah.
So yeah, a lot that can be done, and we think that the health arguments can really increase the motivation, because we've tried using the environmental arguments for years and they haven't really cut much, they haven't really had much impact. And I think that COVID has really thrown into very sharp relief how important our health is. And for the first time, really, public health is at the centre of the political stage. It's never been there. Well, it's not, certainly, I think in most of us' experience, it has not been there. It is now in the centre of the political stage. Policymakers have understood how important it is. And I think we have an unprecedented opportunity to make this case for urgent action on health grounds, and also capitalising on these big benefits to health that would occur from rapid decarbonisation.
Volker, I'm not sure. Have you seen the question on the chat? Let me ask that. So it's from Najat Saliba. Thank you, Andy, for this excellent talk. What are your thoughts on how to make policymakers listen to the science presented?
Yeah, thanks, Najat. That's a very important question, and one that's worried me for a long time. How can we get policymakers listening? As I said, I do think we're in a different stage now, because they are beginning to listen to the fact that health is important. We've seen the whole world economy disrupted by a pandemic because public health processes were not put in place. And I think this is a very potent lesson for what can happen with climate change. But with climate change, there will not be a vaccine, of course, and climate change will not go away in a few years. It'll be with us for decades, centuries, perhaps millennia. So I do think that the health argument can help to swing get the attention of policymakers. I think there's evidence from opinion polls from around the world that as we hopefully emerge from COVID over coming months, years, we will do so on a healthier and more sustainable trajectory. I think there's a lot of public support for that. Whether that's sufficient to overcome the inertia system and the vested interests remains to be seen. I do think there's a greater understanding now that the current pathway that we're on is not sustainable, and particularly amongst the young. You know, if we talk to our younger colleagues, they're much more, I think, attuned to this agenda than some of the older colleagues are. And of course, that you know, people like Greta Thunberg and so on have mobilized lots of young people. So I do see new cohorts of people coming through with different views and much clearer understanding of the threats of climate change. I think there's a great deal more that we can do to mobilize the health argument, to really put pressure on policymakers to take action. And it's been very heartening to see how the Biden administration, even in the last few days, has been taking some action. We know in the States that this health argument is also beginning to get some traction, and we hope that it will also be so in other countries as well. So maybe those of you who have entry points to your own government, you can make this argument with your own national policymakers, and let's try to get health put right at the centre of these climate change negotiations, both for COP26 in Glasgow, but also very importantly for COP27 in Africa.
Great. If I may, can you see the chat box, Volker?
No, I cannot see it, but maybe.
Okay, so let me
I can see it, yeah.
So let me say, so from Costa's excellent presentation, thanks. And then what kind of observations are needed to enhance our understanding and base on them well-tuned policies?
Yeah, this is, thank you. This is a really important question. So at the moment, we're not sort of routinely collecting data that would allow us to monitor the impacts of climate change on health around the world. And we don't know what's happening in many of the most vulnerable parts of the world, for example. We do know that it's a rather mixed picture with heat-related deaths. There's a paper going to be coming out in the next few weeks showing that about over a third of the heat-related deaths in over 600 sites around the world can be attributed to human-induced climate change. In other words, they wouldn't have happened without our human activities on the climate. But many of those sites where that study has been done, and there's a big gap around the Eastern Mediterranean and the Middle East, for example. We don't have data from many sites there, nor in sub-Saharan Africa, apart from a few in South Africa. So there isn't any concerted effort to monitor the health effects of climate change. And of course, there are technical challenges to doing that. So that's one thing that really needs to be done. There is the Lancet Countdown, which every year reports, gives a kind of overview of climate change and health, but a lot of its estimates are based on modelling, on indirect measures and so on, so that it does produce some useful data, but there are big gaps in that data, and we need to have really a network of monitoring sites that are monitoring the vulnerable populations around the world, both in rural and in urban areas. And certainly that's an argument we've been making for some time about the need to invest in public health surveillance systems that would allow us to make causal relationships between the environmental change and human health, and also to determine where the limits to adaptation are. Because as I've said, you can adapt up to a point, and indeed heat-related deaths are going down in many parts of the world. That's because populations are adapting. But there will be a limit to adaptation, and suddenly those heat-related deaths will start to go up. And once that happens, we're going to be on probably an irreversible course, because it means that they will have exceeded the current limits to adaptation. So it's really important for us to understand where those limits are. They will be different in different parts of the world. What we can do to influence people's vulnerability and susceptibility to climate change. And that does require much better data collection. And I suppose the only other point to make is we also need to have better estimates of the benefits of the decarbonising economy for different countries. So the work we've done obviously gives estimates for a range of countries, but we need to flesh that out. We need to augment that, increase that with some real life case studies of what actually happens when you decarbonise and what kind of benefits you actually get. And we're starting to try to collect some of that data now, but it's not easy to do for various technical and other reasons. But yeah, a lot of work needs to be done, and very keen to continue this discussion and debate.
Okay, I think, George and Andy, if you agree, I think we should move on. Thank you very much for this fantastic presentation, and in particular raising the point of case studies, which we are always, I think, we are short of. This is something which has to go on. Yeah. Andy, thank you for participating, and we wish you an active day, and I'm sure you will have it with all your other activities. Thanks a lot.
Thank you very much, everyone. Thank you.
Thank you, Andy.
So, George, I think we move on and we come to Robin's presentation. Do you want to introduce him, or should I do this?
No, please go ahead, Volker.
Okay, the next presentation will be given by Robin Fierce. Robin Fierce is our program director in EASAC and one of the most important colleagues we have in our group, dealing with the aspects of bioscience and health in our big program of EASAC, but also participating in our global project on climate change and health. And we are very happy, Robin, that you take the time now and give your view on your regional and global perspective on climate change and health in Europe. Please go ahead.